So I'm Professor Hugh Williams. I'm a clinical neuropsychologist at Exeter University. I'm particularly interested in traumatic brain injury, so injuries to the brain where the brain might move around inside the skull after it's been hit and somebody's fallen to the ground, or car smash and so on and so forth. My background is having worked in the health services in the rehabilitation of people after traumatic brain injuries. Brain injuries tend to happen in children and young people, so when the brain is still developing. And one of the critical factors is understanding how the brain that's developing can respond to these kind of injuries. And the brain's developing particularly at points through adolescence and late adolescence, when kids are 13 to 15, 17, 18, and even when 20, 21. The brain of an adolescent is even more likely to have problems after even a mild traumatic brain injury. So the kind of mild traumatic brain injuries that we can actually study are the ones that people have in concussive sports that involve contact, like rugby. Because what we can do is we can look at how people were before they were concussed, before the season starts. Then we can look at how they responded to a concussion, and then we can track their outcomes over time. So this project that we're developing at Exeter with the University of Queensland in Brisbane looks at how we can better understand concussive events in rugby playing athletes. And this will allow us to look at these relatively mild traumatic brain injuries, where we can look at how recovery is best managed in these young athletes. So what we're able to do is we can look at neuroimaging, so looking at how the brain actually functions using fMRI, functional magnetic resonance imagery, and also can look at diffusion sensor imaging, which allows us to look at the connections across the brain. And we can look at cognitive functions, looking at attention, concentration, and so on and so forth. And we can look at when the brain is actually injured in a concussive event, how quickly the brain restores itself and comes back online fully, working together with Exeter Chiefs in Exeter and with the Brisbane Broncos in Queensland as well. So this kind of detail will allow us to better understand what is it about some people that leads to their concussion having worse effects, but also what can be associated with better recovery. So we're going to be looking at how to improve recovery in our athletes over time. So what we're really looking for here, to use a rugby metaphor, is somebody who can be in a number 10 or number 12 jersey, in a sense, to be able to look ahead at what's coming towards you, make decisions under pressure, and enjoy doing this project.